86-year-old male here for right elbow pain for a couple of days. No injury. He had a similar thing in the left elbow almost a year ago, like 10 months ago, and he had it drained and cortisone injection, which helped a lot. Today he had an x-ray which shows pretty moderately sized effusion, I believe. Here we're going to go over some basic elbow anatomy, just not including the musculature. We can see the capsule, we can see the posterior fat pad in the olecranon fossa. And now we're rotating, we can see the radial collateral ligament, the angular ligament. You can see the anterior fat pad, or appreciate the hyaline cartilage over the capitellum and the trochlea. Here we're going to go over specifically this procedure. The elbow is flexed to about 90 degrees. Here you can appreciate a distended capsule, and now we're making the capsule translucent. You can appreciate the posterior fat pad. Our needle is going through that posterior fat pad. This is an in-plane approach, and here we're aspirating the liquid out of the joint itself, and now we're injecting a little bit of cortisone. Here we're looking at the posterior elbow, essentially the olecranon fossa, which has a pretty large effusion. You can see the posterior fat pad. It's pushed up posteriorly towards the triceps muscle. Here we're now looking at the lateral elbow. You can see scattered tophi within and underneath the common extensor tendon, and a double contour sign over the capitellum, which is pretty specific for gout. Here you can see that urate icing or double contour sign again. So he has maybe a calcified tophus there just under the common extensor tendon, kind of in the radial collateral ligament. Look at this now in a short axis view. Right side of the screen is going to be kind of radial. Here we're looking at the lateral precondyle. You can appreciate the brachioradialis muscle to the right. Here we're looking at the common extensor tendon in cross-section. You can appreciate that tophus underneath it. Between the common extensor tendon and between the bone itself. Here it looks like the angular ligament is brighter than expected, so there may be urate icing of the angular ligament itself. Here we're starting the procedure. The probe is in a sagittal plane over the posterior elbow. It's an in-plane approach. You can see the needle going into the olecranon fossa. You can also appreciate the posterior fat pad that it initially goes through before it actually gets into the fluid. So here we're pretty deep in that fossa. You can appreciate the tip. Stay still. We got the fluid out, okay? Looks like you have gout, I think, okay? I think this is a gouty attack. Cortisone.
Ultrasound.
Here I'm injecting a mixture of saline with 10 milligrams of depot medrol into the olecranon fossa.